Welcome to today's program. Welcome to Future Generations University. At Future Generations University, we believe in the power of people working together to transform communities. We offer a master's degree in applied community development using the principles of learning while doing. Individuals from around the world apply methods and tools to create sustainable change within their own communities, which serve as their individual classrooms. The master's program guides students to tackle real-world community challenges in areas such as livelihood development, environmental conservation, health, peace building, education, food security, and more. Our seed scale approach ensures that solutions are not only effective, but also locally driven and sustainable. Today, we are proud to celebrate the alumni of our master's degree program, dedicated change makers who are using what they've learned to uplift their communities, address pressing challenges, and inspire others to do the same. So this is an alumni success sharing session, and it is a dedicated platform to highlight their incredible work, share valuable insights, and foster connections across our global network. So we are overjoyed to have you join us here as we learn from two of our outstanding alumni and explore how they applied education to drive meaningful change that is affecting not only their communities, but the world. So with that, I turn it over to our presenters.
Thank you. Let me introduce myself. My name is Meya. I'm going to be the moderator today. And I'm joining you from Spain. I am the alumni coordinator, and I have had the wonderful opportunity to chat with both Sam and Asres and hearing about their journey. And so I'm excited to hear them share this with you today. So Asres, would you like to introduce yourself next? And then Sam will introduce himself and we'll start the presentation from there.
Good morning and good afternoon, colleagues attending this success sharing session. My name is Asres. I'm currently working as a senior field coordinator for International Rescue Committee, Sudan country program. So I'm leading two big field offices in two states, in River Nile state of Sudan and Khartoum state of Sudan, where Khartoum is typically the epicenter of the war, the civil war happening in Sudan. So I am leading a big team, which is around more than 100 staffs in these two states field offices. Thank you. We'll come back.
My name is Samuel Meya. I'm Executive Director for a local organization called Goodwill Community Development Partners. I'm working here in Malawi, but previously I've worked in a number of countries and traveling in a number of countries. Apart from that, I was working in South Sudan in the north part of Sudan, Upper Nile, which is called Banki. And there, after expiry of my mission, then I came back to Malawi. My work has been on WASH, and as somebody doing WASH, I have been involved in a number of things, of which some of which I will share with you. But some of the work that I've been doing, maybe because of time, I wouldn't be able to share with you. I think let's go ahead with the slides. WASH implementation is holistic, which needs a holistic approach. And mostly, Asres will bear with me that in WASH, we use a number of approaches so that we maybe consider people's participation and involvement. And in most of the time that we have been working WASH, we use a number of participatory approaches that are dynamic in terms of how we interact with the community. And mostly, as WASH it's just an abbreviation which translates to water, sanitation, and hygiene. Some opt to use health as in place of hygiene, but it's in the same category. In most of the times in WASH, we use these participatory approaches like seed scale, CLTS. CLTS is community-led total sanitation. First is the participatory hygiene and sanitation transformation. We also use participatory rural appraisal. We also use community-based management and also asset-based community-driven development. All these, we use them so that we mobilize our subjects to interact with them, and also mostly is to instill a sense of ownership in our communities. So as we are involving the community with these participatory approaches, the main emphasis is just to have them take the responsibility of whatever investment we are investing in them, because WASH is very expensive. And in terms of its implementation, it requires people to be involved. Next slide. In water, mostly we involve our communities in, let's say, borehole siting, if we are protecting a well, but the community, as part of, they have to make their own community contribution in terms of local resources, such as sand, bricks, and manpower. And we also establish local leadership, of which the local leadership assists us mainly to guide the communities in terms of the investment that we have made, so that the investment is sustainable. And we also established the maintenance fund, of which currently we encourage communities to open bank accounts, of which towards the end of this presentation, I'll also show that this maintenance fund, how it has assisted our communities to alleviate their poverty. Next slide. And we also do sanitation, and mostly in sanitation, we do construction of basic household latrines. I was reading a certain magazine, and it was saying up to now, there are almost over 500 million people who don't have a latrine up to this date, of which this is detrimental to other people's health. So as for us, we encourage people to have at least a latrine that they may use. And this latrine, we use all other those participatory approaches for people to have latrines. You'll see from the pictures below that like the second picture, that is just a latrine that a person who has just come from the bush to a latrine. Now, that's when we come in with the other methods like participatory hygiene and the sanitation transformation, which is first to assist these communities to go into sanitation ladder, what we call sanitation ladder. In this sanitation ladder, it assists these communities or to improve their latrines to a certain standard, up to flushing standard. So this is mostly what we do. We also train local communities as masons so that they assist communities to construct latrines, particularly when we have engaged them in FAST. So we engage these local masons to assist the people to construct low-cost latrines using available resources or other resources. As we go on, I will emphasize on what people are engaged in when they go into fast. Next slide. And the other thing that we do mostly is hygiene promotion. In hygiene promotion, we are involved in mass communication, of which mostly we involve all other communities to wash their hands with soap. As you have seen, it was last week when we were celebrating Hand Washing Day. And this Hand Washing Day, we promote people to use hand washing with soap. We emphasize soap because soap cleans the hands thoroughly. If you see, we emphasize on behavioral change, because most people, they just wash hands without soap. Let the hands, the dirt is still recognized when they use. Let's say we have used other methods to see if the hand washing is thorough, if they just wash their hands without soap. We have witnessed through the egg and the cassava methodologies that if you wash your hands without soap, the hands remains dirty, and that's why we emphasize to wash hands with soap to avoid dirt. And this also, we also promote hygiene with the IEC messages through, sometimes we also do panel discussions so that people get the message thoroughly. And after getting the message thoroughly, they also spread the message. And mostly we like to engage the school children who are our patriots in terms of behavior change. Next slide. And the application of C-scale into on WASH. You'll notice that we have taken somebody who was defecating in the bush, and is now constructing a temporary latrine, which is, we are trying to build from the success that he has endeavored. That is the person's human energy. And also the mobilization of materials. You'll see that most of the materials that we use, the local materials, the labor itself, and even the indigenous knowledge that we use during building from success. We also, as the organizations, we involve them in three-way partnership involvement of extension staff, the donor community, and the other stakeholders, so that we improve on the latrines that they are using, and also making WASH sustainable in terms of the impact. And this also helps us also to make sure that when we move out of that community, the investment that we have invested is never wasted. Is never wasted in terms of, it doesn't say, they don't just say once the donor is out, the project also ends there, or the program ends there. They continue as communities, and they continue learning from each other. And we also make sure that there is evidence-based decision-making within the community, whereby communities and the other communities learn from fellow communities, and they go on with the activities that we have been doing them. And we also make sure that the outreach is also multiplies from a small community to a larger community. And our also emphasis is on behavior change. Next slide. And going to scale, you'll notice that we pass on message from us as the extension staff. We do train masons, and these masons, they train each other and also do the casting of slabs, the construction of other latrines when people have engaged themselves in fast. And when they have gone with the first methodology, they are able to go within the sanitation ladder from a latrine that was just a temporary latrine up to a flush latrine. And mostly we generate visions from the community so that communities are able to draw their own vision where they want to be with a good latrine and which type of good latrine they want to achieve at the end of a certain period. We also promote sanitation marketing, of which these masons, they have to make sure that they promote sanitation at a local scale so that all the people that they reach out are able to attain good type of latrine. We are also promoting climate change mitigation, of which we are promoting compost manure making. You know, nowadays fertilizer is very expensive, and we encourage people to use fecal matter as part of manure, and this manure is applied as the feces as the compost and the urine as the other fertilizer like urea. And we also encourage people, nowadays we are encouraging people to save energy in terms of using electricity. They are using biogas, and this biogas also promotes climate change mitigation. And the technologies that we are using technologies that reduce cutting down of trees. And you'll notice that mostly when people have gone into the sanitation ladder, they use cement, they use other methodologies that we have devised to reduce cutting down of trees, which is part of climate change mitigation. Next slide. And we also established the village savings and loans from the maintenance fund. This is the emphasis of what we are talking today, as we are implementing the, as we are commemorating the Day of Poverty Alleviation, because in a small scale, people started in a small scale to use the maintenance fund as part of village savings and loans. So after saving from making some procurements of the most wearing parts, the savings that they had, they started to lend to each other so that they embark on small scale businesses. And this has gone, it has scaled up, and most of the people, they are being able to use these funds into small, businesses. And these businesses, they are even going far as our local towns to do their business. And also communities are able to adopt other latrine technologies from the basic latrine to, as you can see on the picture on my right, you'll see that people are casting slabs. Those slabs will be used to cover up the whole of the latrine. This is for pit latrines. And some of them, some of the slabs that they are casting, they also use it for biogas. You'll see the other, this picture on my down on left there. There I'm demonstrating how to construct one of the low cost latrine that doesn't use cement. It doesn't use trees. It's just something that people use, and they close the hole using bricks, and that latrine is low cost because everybody can afford at a community level. And you'll see that this is expanding to other communities, and through their own learning, the communities, they learn from each other, and it's expanding. Next slide. And during, with the establishment of the village savings and loans from the maintenance fund, we piloted in one of the areas that we are working in Palombe, and it generated interest of other communities. So the interest that it generated, it made other people to also adopt whatever was happening in this village. It was through local community learning, and it has expanded to other districts. And you'll see the populations that are there through the table that I'm showing, and the amounts in US dollars that people have been able to accumulate. These are figures from last June, and from this time around, I think I can generate other figures, of which I can show you some other time what where people have reached. And in terms of repayment rate from the loans that they get from the maintenance fund is 99.8%, of which the default rate is just 0.2%, which is for us a good gesture from the local communities, because this is something that they own, and they are showing that the fruits of their sweat, they are enjoying it. And this also has reduced a number of things in terms of people are able now to construct good latrines. People are able to embark on poverty alleviation strategies like businesses and other things. So I think that's the end of my presentation.
Thank you, Sam. We're going to be moving from Malawi now to Sudan. Deborah, can you advance the slide one more? So these are some of the topics that Asres is going to be covering. And so I just wanted to shift our gears a little bit as we go from the poverty alleviation things that Sam has been doing in southern Malawi. Now we're going to be moving up to Sudan. So Asres, please go ahead and start your presentation. And thank you so much, Sam. We're going to be coming back to you in the question and answer part.
Okay.
You're welcome. I think I'll answer the questions when they come.
Okay. Thank you very much, Chris, for organizing this success sharing session, webinar. And thanks also for Deborah and Lindsay for the support you are providing. So just as I already introduced myself, I am Asres, the Senior Field Coordinator for International Rescue Committee, IRC. I worked in Ethiopian country program and then later briefly worked for Cameroon IRC program briefly, and then for South Sudan IRC country program, and then currently I'm working for Sudan country program. So coming to my presentation, this is the Sudan IRC response, responding to crisis and to rebuild from successes within. So I am working in River Nile and Khartoum states. We have two field offices, big field offices in the two states, and I am leading the overall operation or the overall implementation in these two states. So majorly our response, integrated multi-sectoral response, we have health and nutrition, WASH response, protection response, and cash assistance. And then we have, we worked in this response using the community resilience in crisis. We use the local staffs as well as the host families or host communities able to sustain the support to the displaced population. The local staffs, they are themselves are become IDPs. Almost 90% of my staff become IDPs. They, you know, this is majorly in Sudan. There is, you know, civil war, which is one of the biggest humanitarian crises in the world. So the staffs themselves become, you know, an IDPs. They shifted from one place to the other place, but at the same time, they're able to support the internally displaced people. And at the same time, the host families or the host communities are able to support their citizens, and which is highly supportive for the IDPs. We are trying, as an IRC, we are trying our best for restoring basic services, water, sanitation, health system, for the displaced people, as well as for IDPs or internally displaced people who are returned to their area of origin. Next slide. To give you some highlights about situations in Sudan, from the different country programs IRC is operating, Sudan is a country program with which is top of the IRC emergency watch list. It is the toppest one, and it is, you know, facing the world's largest humanitarian crisis, in which almost 30 million people are in need. You can imagine the number, and around 12 million people have been displaced. So IRC, together with other partners, local NGOs, international NGOs, UN agencies, with Sudan government, together, we able to do life-saving activities in this crisis situation. Next slide. To give you more figures about IDPs displacement dynamics. By IDPs, I mean that internally displaced people. So around 10 million people are displaced internally as an IDP. And from this, almost 2.4 million people are displaced prior to April 2023. April 2023 is the time where the civil war erupted And prior to that war, almost 2.4 million people are recorded as an IDP. But this time, after the war, or after April 2023, almost 7.5 people become IDPs, as per the IOM displacement tracking matrix, which is published in August 2025. For my data based on August 2025 IOM DTM publishment, so that I don't have the data for September. So I'm based on August data. So out of the displaced people, 53% of the IDPs are children, which are under the age of 18. You can imagine almost more than half of the IDPs are children, which are highly affected. As you know, children and women are one of the very vulnerable segment of a community whenever there is war. To give you another figure, around 2 million IDPs from the total 10 million are returned to their area of origin when their places become peaceful or security improvement is seen. People start to return to their area of origin. And out of that, 2 million IDPs which are returned to their area of origin, around 1.5 million are returning from within Sudan, while the other 500,000 people are returning from abroad, from the neighboring countries like Chad, South Sudan, Egypt, Ethiopia, Libya, and the likes. An estimated 1.5 million individuals are returned from locations within Sudan. When the war erupted, people are migrated or displaced into different states of Sudan. So you can see the figures. These are Gadarif, Khartoum, River Nile, Kassala, Al Jazeera, White Nile, Northern, and Sennar, Red Sea, are the different states of Khartoum, Sudan. And the percentage you can see, people from which location are returning to their area of origin. You can imagine the figures. So the place where I am working, River Nile and Khartoum, the displaced people are returning, and you can see the percentage. Next slide. Still, I'm talking about the displacement dynamics. Within Khartoum, an estimated individuals of 605,000 returned to different locations in 7 localities. In Khartoum state, we have 7 localities: Bahri, Jabal Aulia, Durman, Bada, Sharganil, Khartoum, and Kereri are the 7 localities within Khartoum state, which is one of the biggest states in Sudan. So around more than 500,000 people are returned to those localities of Khartoum state because of the peaceful situation currently in Khartoum state. But initially, Khartoum state is one of the epicenter of the war, from which quite a lot of people are displaced. As you can see, the state of origin for the internally displaced people, Khartoum comprises the majority of the displaced people. Around 3 million people displaced only from Khartoum state, which comprises 31% of the displaced people. Next to Khartoum is South Darfur and North Darfur, which shows quite a lot of people displaced from this another 2 locations. So a total of, from the 3 locations, a total of around more than 7,000 people are displaced only from these three locations, the major locations where IDPs are seen. So the next slide. In River Nile, quite a lot of gathering sites were being there, but later on, due to IDPs are returning to their area of origin. Currently, we have only 3 gathering sites. But in general, the people in gathering sites are very minimal compared to the people hosted by the host family or host community, and the people who are renting houses or accommodation in different locations. So in River Nile, 69% of the IDPs are staying in host family and host community, and 22% are accommodated in a rented house, those who have the capacity to rent. But in the gathering sites, 5% of the people go. As you can see in the last row, if you can see, in January 2025, around 1 million IDPs were being recorded in River Nile. But later on in August 2025, the first row, if you can see, only 500,000 of the IDPs are recorded in River Nile, which shows IDPs returning dynamics. Let's go to the next slide. So to show you what IRC is intervening, we are doing integrated multi-sectoral responses with health and nutrition, WASH, protection, as well as cash assistance. And we are serving conflict-affected IDPs, internally displaced people, and the host community. As you know, a lot of pressure also is coming to the host community, so that we cannot only support IDPs and ignore the host community. So we support both IDPs and host communities. We work with local partners like national NGOs or local NGOs. As per what we have learned in seed scale, we work from the three-way partnership. We work with local partners, we capacitate their capacity, and we work with them. And then we also use the government professionals as a secondary staff. For instance, in the different health facilities, if we think to recruit IRC staffs for the health facilities, then it will be very, very difficult. And we cannot give a scaled up supporters, so that to make it scaled up and to give more support for the community, we used the local government professionals in Ministry of Health, so that as a secondary staff, we use them and we support the response in the different health facilities as well as in other sectors. Next slide. To give you briefly what we are doing in health and nutrition, we give access to primary healthcare services for the community. That means we rehabilitate health facilities. We provide medical supplies like drugs, medical equipment. We support reproductive health. We support mental health and psychosocial supports we provide. And then with nutrition response, starting from a comprehensive MUAC screening up to supplementary feeding, referring of complicated some cases, kind of things we support for under 5 children, pregnant, as well as lactating mothers. And then we are supporting patient referrals to secondary care services, because IRC is majorly working for primary healthcare services. But if there are complicated critical cases, we also support the referral system into secondary care provision service centers. Next slide. This is one of the health center in Shandi locality of River Nile State, where this is IRC targeted health facility, which is providing quite comprehensive support to the community. We are the one, it is IRC which recently rehabilitated this health facility, and this health facility is supporting both the health, the local community or the host community, as well as the IDPs who are living in Shandi locality of River Nile State. Next slide. Another sector we are working is WASH. Majorly, it is not WASH like the one Samuel mentioned, that is community WASH, what Samuel has mentioned. This one is institutional WASH. We are supporting the health facilities which are targeted by health and nutrition sector. We support, we complement it. As I said, we are working on multi-sectoral interventions so that we work in institutional WASH, with which we support the selected health facilities with maintenance, rehabilitation of the building, rehabilitation of the water system, establishing of waste collection zone, construction of or rehabilitation of latrines, kind of these activities we support in the targeted health facilities. And in addition to the institutional health institutional WASH, we also support on cleaning campaigns, health promotion activities through community volunteers from the community. And then we provide water supply to the health facility with different connections. And as I mentioned, we also provide or rehabilitate latrines for the health facilities. And we also manage waste management and disposal system for the health facility. We distribute hygiene kits for the community to keep themselves hygienic, to protect them from different diseases. And we promote positive hygiene practices, which some mentioned very well. I will now go to the detail of that. Some already mentioned it in detail. So on that kind of hygiene practices, we work strongly. Next slide. This is one of the latrine which we have constructed in Alumni Health Center, which we have rehabilitated it. It was not been like this previously, but IRC rehabilitated it very well and make it conducive and user-friendly to support the community within the health facility. Next slide. This is again in Alumni Health Center. This is the water connection that we have done in Kerari locality, Khartoum State. There is nearby community water, and we have connected the community water supply to the health facility, and the health facility is getting good water supply to fully function for the different activities within the health facility. Next slide. This is Al Sheikh Al Taib Health Center, West Zone, in Kerari locality, Khartoum State, in which we have established a West Zone. In some health facilities, we establish in some health facilities we establish incinerator, but in some of them we establish waste zone, and using this waste zone we manage the waste management is handled very well. Next slide. The other sector which we are working from the multi-sector intervention is integrated protection. We support women and children in case prevention as well as case management, psychological support, health support, referral system to other services for the community. And then group psychological, psychosocial support through coffee session, discussion sessions, and life skill activities. We also distribute dignity kits for women and girls. As you know, people affected by war, sometimes they need, especially women and girls need different supports, and among them is dignity kit support, which has different items, so that we support them with that. And then we have a awareness session on GBV, gender-based violence, by engaging community leaders, community protection networks, and others, so that especially the very vulnerable segment of the community is women and children, so that we work strongly on GBV, and this is one of the activities which we have under integrated protection. The other is safety assessment, safety audits, like GBV risk assessment we do, what risks are seen in a specific area, especially for IDPs in the gathering location and within the community, so that we support them on awareness to be protected from any GBV risks. And then once GBV cases are happening, then we support with referral system for GBV survivors by giving all the different supports to them, psychosocial support, even health support. We link them or we refer them to our health and nutrition response, so that they get the different supports. Next slide. The other one is multi-purpose cash assistance. It is life-saving assistance to the internally displaced people and vulnerable households through provision of cash assistance to meet their basic needs. They may need the money for food, for water, for medicine, for repairing their shelter, or for buying non-food items. So we give them in 3 rounds. Every month we provide them money so that they can sustain their life. It involves community engagement to properly identify the people, because cash response is a bit sensitive response. Everybody may come and may request the cash assistance, so that we properly engage community to identify the highly vulnerable people, and we register them, we verify it, and then we assess the market, how the market is supporting them, what minimum basket expenditure is currently existing, so that to fix the cash that need to be distributed to them. And then we distribute the cash, and then later on we do post-distribution monitoring to see how they have used the cash which is supported to them. Next slide. In addition to the different multi-sectoral responses to the IDPs, we also responses to onset emergencies, especially heavy rain, flash floods, and cholera outbreak is one of the critical emergency happening in Sudan. If I can give you figures, recently in River Nile State, where I am working, 2 localities or provinces are highly affected by the current flood. Around 792 houses destroyed, 1,172 houses damaged. Public water networks are partially damaged and unreliable. A lot of latrines collapsed. different diseases, disease outbreak is seen, like diarrheal disease, other waterborne diseases, malaria, and the likes. This is one of the very critical emergency situations in Sudan, in addition to the effect of the war. Flood and cholera outbreak also affected Sudan. Next slide. So the main challenges, house renting is not affordable for IDPs whenever they displaced to other locations. So they mainly hosted by the host community, or they ended up in gathering sites. During active war, with a lot of shellings, intervention in Kerari locality of Khartoum state were being difficult, but I'm proud of being part of this implementation, and together with the heroic Sudanese national staffs, we able to manage a lot of intervention while the war is going on. Excessive burden is happening on the existing infrastructures like health services, water supply services, and others in areas where IDPs are hosted, because the host community, while they are having infrastructures which needs support, when the IDPs are added on those infrastructures, a lot of pressure is happening on the host community. That is one of the big challenges I have seen. Due to destruction of various infrastructures in the war area, IDPs who planned to return to their area of origin, they faced a lot of difficulties to start life because many infrastructures were being destructed. So basic services like water, power, health, and the likes are not well restored, but government is also putting quite a lot of efforts to restore these infrastructures and to encourage more people to return to their area of origin. And UN agencies and other local NGOs as well as international NGOs are also putting quite a lot of efforts for restoring the infrastructures in the war-affected areas. Another challenge which we have seen is there was been attack on infrastructures like power stations, and electric power as well as water supply provision has been highly affected before because of the attack on power stations. You can imagine how much it can affect the community. Next slide. So another challenge was been an access challenge. As you know, in war area, access definitely will be a challenge because of various reasons. So in some contexts, access was been big challenge and implementation speed has been affected. And sometimes it is very challenging to reach to the highly needy community because of the access problem. Majority of IDPs are staying in the host family or community, and addressing their needs properly is challenging because of their scatteredness. Sometimes to register and get them easily is very difficult, but we tried to manage it as much as possible. And sometimes after you register them, suddenly they may travel back or they may return back. And in that case, activities which is planned for them were being challenging. Next slide. Let me go quickly about the success. As I have mentioned, almost 90% of the staff become IDPs themselves, but I really proud of the Sudanese national staffs who are the big heroes who able to support the community. For instance, when the war starts in Khartoum, our team displaced to Medani, Jazeera State. the staff again traveled to Gadarif state, and then later on from Gadarif state to Port Sudan. So you can see they almost 90% of them are IDPs themselves, but they are supporting the IDPs. So I really feel proud of being the member of this team, and we're able to manage to support the community, especially the IDPs. And one of the big success for me, building success from within. So the community, rather than the people displaced, rather than majority of them to go outside their country, the community, the host community, able to support the IDPs within Sudan. So that this is really a big success for me. So that quite a lot of IDPs were being supported by the community rather than going outside of their country. And the IDPs also become resilient and able to cope with the situation. So this is also one of the big success I can say. And then from RC side, we're able to manage 5 primary health care centers and 3 nutrition facilities in River Nile. And we're able to support 7 primary health care centers and 4 nutrition facilities in Khartoum. So with this, we're able to reach to around 150,000 beneficiaries. And with the current activities, we are going to address around 500,000 beneficiaries at the end of the fiscal year. So these are the big successes I have seen with the intervention. And the 3-way partnership with government, with local partners like local NGOs were being great, and that is also a big success to support the life-saving activities. Next slide. So this is my last slide, and the attention areas I would like to mention is one of the attention area is restoration of basic services to facilitate returning of displaced people to their area of origin. Quite a lot of infrastructures need to be restored. Quite a lot of efforts are happening by the government, happening by other actors, NGOs, UN agencies, but still depending on based on the scale of the affected people, still a lot of efforts need to be done. And I want to put my voice for Sudan so that the international community to listen and support Sudan in a better way, considering the high humanitarian crisis in Sudan. So Sudan is facing, the other thing is, we are working on life-saving activities, but a lot is need to be done in the future because people are returning to their area of origin. They need to start their previous life so that development and resilient projects need to be in action more and more, so that people can have more support, more livelihood activities, so that they can be stable in their area and they can return to their life very soon. And my final saying is Sudan is facing the world's largest humanitarian crisis, but compared to the scale of the crisis, attention is not given very well to Sudan. And I would like to voice for Sudan to get more support, the community to get more support, so that they can be coming back to their lifestyle where they were being previously. Quite a lot of effects are happening in the community, so it needs a lot of support from the international community. Sorry for taking more time. Thank you very much. Back to you, Chris.
Thank you, Asres. That was such a great presentation. And I have questions for both you and for Sam already that have come in. And so I'm going to just start in with those right away. The first question comes from Ms. Afiri. And he says, thank you for your insightful presentation, Sam. How have you managed to integrate different approaches such as community-based management, seed scale, and FAST in WASH initiatives to come with to see the generated impact? Sam, you're muted still. I'm gonna give it another moment here. While Sam gets back with us, I'm gonna go ahead and I'm gonna go to the next question. And this is a question from Daniel to both Sam and Asres. He says, brilliant and so important work that you're both doing. Very proud to be a colleague of yours now for both of you for 12 years since you met in India. His question is, to what extent do you get participation from local business? You've described your NGO contributions, also the community contribution. What is the business role, if any? And you're helping their work through WASH activities and other activities, which is improving their economy. So what type of participation do local businesses have? Asres, do you want to try to answer that question first?
Thank you so much, Chris. Good morning or good afternoon, Professor Daniel. Happy to see you in this presentation, in this session, our professor. To address your question from my side, as you can see, in war area, quite a lot of needs are there, and we have seen a lot of business people like vendors encouraged to support the community with different supplies. Sometimes when you are in a war-affected area, the market will become very devastating. And in that case, if you are thinking of bringing different items to support the community from abroad, then that will become very challenging. It will have a lot of time-taking processes. So quite a lot of vendors become encouraged to support their community, even in a very fragile situation. They're able to, participate in the business, participate in the market, and we able to get different items. For instance, non-food items, dignity kits, hygiene kits, even different drugs. We're able to get from the local market vendors. And in my belief, they participated a lot to save the lives of the community in Sudan. With regard to participation from the community, let me pick the protection sector. In the protection sector, there are IDPs who are living with the host community. At the same time, both the IDPs as well as the host community, there will be possibility to be affected with different protection concerns. So in that case, community leaders, whenever we involve them, they can play quite a lot of roles in protecting the community in looking into the risks so that to mitigate before it affects the community. So we get local partner, local leaders involvement. At the same time, we selected community members to be part of the protection network, so that from different segments of the community, we able to involve different community segments, youths, girls, women, men, so that integratedly those segments of the community members represented their community, work on risk mitigation for protection, so that this is one of the examples I have seen in our intervention.
I'm going to continue on with I have quite the list, so I'm very engaged audience here. And for those of you, if for some reason, if Sam can't make it back, don't worry. Any of the questions that you have, I will connect with him. And all of the questions and responses that we have from this session are going to be posted in the Alumni Facebook group. So even if your question is not answered here, we will be able to get that out to you after the presentation. So I'm going to continue on. And the next question that I have is from Asemenu from Ethiopia. And he's a recent graduate. Thank you. Love to see them here. And he says, I wonder what mechanism is in place to balance the support of IDP and host communities. Apart from alleviating the strain and humanitarian services, are there any agricultural development support / development interventions that your organization has implemented? His particular organization has designed a development project in agriculture to support IDPs and refugees from the Somali region. And he would like to be in contact with you for more information. But if you have a response of how if there's been any projects that have worked with agriculture with the host community for your contacts, please, he would love to hear it.
Thank you, Chris, again. It's a very good question. Actually, as I mentioned it, this intervention is the war already, after the war is erupted, almost now it is 2 years plus. And after we established the River Nile office and re-established the Khartoum office, it's only a matter of 1 year. And for those 1 year plus, we supported life-saving activities. It's very difficult to think about development projects at the moment, because you can imagine the scale of the IDPs. Quite a lot of people are displaced, and you need to strongly work on the life-saving activities. It is the first thing. So once you address the life-saving activities, then you can start think of the development activities, the resilient activities. That's why in my suggestion, I have indicated it needs more development and resilient projects in the future. But at the moment, quite a lot of life-saving activities are in need. And my organization fully focused on the life-saving activities. But for the future, depending on the context, depending on the situation, we may think of development activities. But at the moment, we are not doing any development activities.
Thank you. I'm gonna kind of dig a little into his question, because I think what he's considering is the production of food in the host community, and if there's any collaboration with the host community for food production for the displaced people. And so that, I think, is he says, actually, that's very logical, and thanks for your response. So, but I will ask that question myself. Is there agricultural activities that are promoted with the host community to support the displaced people?
Okay, thank you very much, Chris. It's a very good point. Actually, in the location where I am working, the two states, River Nile State and Khartoum State, you know, because especially in Khartoum State, quite a lot of displacement happened. And in River Nile State, the agricultural locations are other states in Sudan. Is not as such big agricultural activity I have seen in River Nile while the community is hosting the IDPs. Quite a lot of agricultural products are even coming from the other states to River Nile State, which I have observed. So no big activity as such in complementing food supplies for the IDPs.
Okay, thank you. And to be on the challenges and mitigating measures of those challenges, could you provide some examples?
One of the mitigation measure could be to have, you know, the three-way partnership very well in place. For instance, involvement of the government. Government has a big role in supporting to mitigate the different challenges. As an organization, you cannot do anything alone. So we involve the government, we integratedly work with the government, indicate what key challenges can affect the community so that we get their supporters. For instance, if I raise about involvement of the local leaders for GBV awareness session, when you involve them, they have a very good role going to the community, awareing the community, and supporting to reduce GBV cases, for instance. That is one thing we do. The other thing is we involve the local partners, for instance, local NGOs. They know the context very well, they know the community very well, so that we establish different community committees for the different services, be it protection, be it wash. For instance, for wash, we have a different health and wash committee who are protecting the infrastructures, which we did, who are following for effective utilization of the resources, like latrines, water supply system. They very well maintain it and keep it to serve for a long time. Such kind of mitigation measures we take to make the community effective in utilizing different services.
Okay, so I'm gonna go back to one of the questions that Daniel had asked earlier about the integration with the local businesses, and you had talked about welders, and he said that you made a great point on the welder contribution. How do you recognize those who are participating with you? And is there a space that's dedicated for them to have some credit in their contributions?
It's a very, very good point, honestly. What we did is, for instance, with the vendors, we call them to our office, we sit together, and we explain them that they are really doing a very good job and they are saving lives. When we say this, even they start feeling of proudness rather than thinking about their benefit. Even they are reducing costs and a lot of contributions I have seen. We give them a very good credit. We appreciate their involvement, and at the same time, some of the vendors they don't really know about humanitarian responses, and then we gave them different ideas, principles of humanitarian responses, so that after they get those sessions, they become very much proud of it, and they become sensitive of time to provide, to deliver items in a timely manner. Yeah, such kind of credit we provided to the vendors, but not yet we acknowledged them with certificate or something. But in the future, we are thinking of that.
That's great. And I think it's interesting to see how just the conversation gets them even more engaged. So I'm going to go back. Rizwal has a couple more questions. Hopefully we'll be able to get to both of them before we have to wrap up. Could you give more insights on integrated sectoral responses, challenges, and strategies that you've adopted in IRC and the role of community engagement?
Okay, thank you very much. Another very good question. For about integrated responses, you know, if you go with one specific sector, let's say health response, then when you go with health response, you may lack the wash response within the health sectors. You may lack other sectors' contribution. So what we did is always when we design a project, we make it multi-sectoral. Let me give you another example. For instance, when we see nutrition response, there are people who are highly affected malnutrition or whatever you can say. So those very vulnerable affected segment of the community, we link them with cash response. We refer them to the cash response so that they benefit from the nutrition, health and nutrition response. At the same time, we link them with the cash response so that they can get cash and they can complement the challenge that they are facing. For instance, if we consider health response, unless you construct latrines, unless you provide water supply to the health facility, unless you are highly involved on the IPC, infection prevention control, by integrating it with WASH, then the health response will not be full. So such kind of very good integration, all the projects we designed are integrated each other, so that we're able to manage in a proper way. For instance, if I can raise about protection, there are also GBV survivors. Those GBV survivors, we link them with cash response so that they can quickly get cash responses, cash assistance, so that they can be supported very well. At the same time, we link them with health response so that they can get health services for what they are affected. So in this way, we're able to manage integrated approach, which is very productive to give a comprehensive support for the community.
Thank you, Asres. And we're going to do one last question, because this kind of points to the next step. Have you had any humanitarian development and coexistence/peace nexus approach? And are you thinking to build the HDCP nexus.
Yeah, a very important point. Definitely, in the coming projects, we are thinking to have a kind of a project which can address, peace building, mutual coexistence. As you know, IDPs are living in the host community. Unless they have, proper understanding among each other, it will be very challenging. So for their mutual coexistence, we will have projects to respond on that. And then mutual utilization of resources. Sometimes when the resource becomes scarce, there will be possibility for clashing between IDPs and local communities. So that how to properly utilize those scarce resources together, more supports for infrastructures, so that to ensure the mutual coexistence. And then peace building in different locations, if it is existing, it will be very, very helpful in such a context. So there are projects definitely we are looking into to consider such aspects of a project. Thank you.
Thank you, Asres. I just want to thank you for your presentation. I also thank Sam. Unfortunately, his network went down and he was not able to join us back, but please do check out the Alumni Facebook group. The link is in the chat. And we will be highlighting his responses to the questions that I've stored up for him. And I just want to thank both of you for being a participant in this today. It was very insightful. And I think, as both of you mentioned, these areas just need more of a spotlight. And so I hope that we were able to give that a little bit more light today. We will be having our next success sharing session in January for international education. And Rosie Lynch will be presenting. She has started a non-formal business for education for children and their parents. And so that is the focus of the next session. It's called Wild Child Museum and Menagerie. And so I'm really excited about this next session. If any of you had some burning questions, but you didn't put them in the chat or in the Q&A, please send them to me at chris.reiser@future.edu, and I will make sure that I share them with our presenters. And I just thank you guys for being such an engaged and wonderful audience. And thank you all for being here and just highlighting how we, different steps on reducing and eradicating poverty. And what a wonderful way to celebrate it today. So thank you so much. And we're going to go ahead and close out this session. Thank you so much, everyone.
Thank you so much, Chris. Thanks a lot.
Great job. Thank you, Chris, for moderating a wonderful panel. Asres, what a wealth of knowledge and of inspiration, and to Sam as well. So I just wanted to come and recognize all of you for your superb job today. Thank you. And thank you to all of our participants.
Thank you so much for our
Take
lovely
care.
university for giving us this opportunity. I really, really appreciate it.
Thank you. Bye-bye, everyone.